So I would like to introduce Tooka Zokaie. She is a senior health policy analyst with the California Dental Association. Her table is clapping, thank you. Welcome. And she will be pitching decreasing dental-related emergency room visits. Green is forward, red's back.
All right. Hi, everyone. So my name's Tooka Zokaie. I'm with the California Dental Association. And just, with the speed dating focus in mind, it's not monogamous. We can be poly here. So there's a lot of different options on the ways that we can address this program. And one of the topics that I get to speak on today, which I'm very thankful for, a lot of people in this room mentored me actually on this topic, is emergency department utilization for non-traumatic dental conditions. And just to kind of go over what that is. So non-traumatic dental conditions are the ones that can typically be preventable or addressed in a dental clinic. You may have seen the scooters around town. And in fact, I recently learned that one of the top reasons for new traumatic emergency department visits is scooter accidents. So be careful on those. That is a dental trauma, and be careful on the scooters. But today we're going to talk about the non-traumatic ones. So I want you to think about a time that either in your own life or in a loved one's where they were in extreme pain or they got sick and there was just like an unclear path on what to do next. You didn't know how to navigate it. And in medicine, sometimes we have some options. Of course, there is the emergency department. We can also think of urgent cares. You may even have your own primary care provider that you can call. But for a lot of Californians and really a lot of people in the country, they don't know where to go when it comes to dental pain. And so one of the places of utilization is the emergency department, because that is what we're, used to going to when we're in pain and we want an answer, even though there isn't dental care in Californian emergency departments. There may be other kinds of specialties that are related to the mouth, but not dental care specifically, and not the right type of providers for these non-traumatic dental conditions. So how high is ED utilization? We've talked about medical dental integration. Dr. Walton Haynes gave a fabulous presentation on, those overarching medical dental integration topics and themes. However, another part of medical dental integration is making sure people have a dental home, people know where to go. And this is where we can also address some medical dental integration specifically with emergency department utilization. And so of all of the, ED dental conditions, that includes those scooter accidents, 91% are non-traumatic. So there's a lot of utilization for non-traumatic dental conditions. And in the US, it's about 2.4 million visits annually. Now, it's so easy to say a number like 2.4, but like I asked you to reflect on your own experience, like these are people's lives, these are their experiences. And that number is very startling to me because that is that many visits a year of people going through pain. And in California, there's about 54,000 visits annually. So again, 54,000 visits. We don't have the data on if those are repeat or not repeat at this time, but still, that's a lot of visits for someone who can go to a dental clinic or have a dental home or have had preventive care to avoid that dental visit. So you may see your own community there and your own county there. So if you do see your county listed, it's not to call you out, it's to say that there's opportunity and that there's opportunity for partnership or for implementing one of the things I bring up. So it really is all counties, they have an opportunity to do one of these things recommended, but these counties specifically, we see that there is some increased work to try to prevent ED visits for non-traumatic dental conditions. And there's kind of two ways that we look at the data. There's the proportion of, the rate. So of all the individuals in the county, what percentage of them are going to the emergency department, and then just the sheer number. So if you're kind of in a larger county, you're more likely to have more visits because there's more people. So in the packets given, we do have a statewide goal, and the goal does include reducing emergency department visits for preventable dental conditions. And a lot of that involves establishing a dental home. And there's a few different strategies to do this. So, we have this overarching goal of reduce emergency department visits and reduce repeated care, but really it comes down to like, okay, well, how do we do that? So that's kind of like my Shark Tank pitch, my tooth tank pitch is we have some paths, some evidence-based ideas on how to decrease the emergency department utilization. And, there's a lot of different strategies right now to try to prevent disease and do the prevention piece. And I think that that is part of the process of trying to decrease this number. But there will be people that are at a point where they need care and they want care fast. And if they do present to the emergency department, what do we do? So there are 3 key ideas to think of, and I want you to think about these for your own county or your own program. So one of them is to work with hospitals. So if dental problems appear in the hospital, it's not, okay, go see your dentist, bye. But to try to do some sort of referral or have a contact. So, try to think, do you know if your local emergency departments and clinics have a dental partner that is willing to see these patients and able to? And then you can link patients to a dental service location in the community. So that goes back to Amanda's presentation with CPCA of the importance of FQHCs, community clinics, and safety nets. So that is another option, is to make sure that those clinics are connected with emergency departments, because people do present to them looking for care. And then finally, this is another one where I think we have the most opportunity in the state, because we don't have these kinds of programs of establishing dental rotations within emergency departments. There are some other states that do this, but it is an option to try to increase that care access. So here, these numbers are based on the Association of State and Territorial Dental Directors Guide to look at different dental codes for non-traumatic dental conditions. These are the primary reason. So you may see different numbers for emergency department utilization for non-traumatic dental conditions. Dr. Walton-Haynes actually taught me this differentiation very clearly. So these are the primary reasons. They presented to the ED because of dental pain. Other people may present to the ED because of other reasons, and then also happen to have a non-traumatic dental condition. But, around 55,000 visits a year. And we don't have the data that separates primary or secondary for 2020 or 2021. I want to use the word yet, but I honestly don't know if we'll have that kind of differentiation. But this all comes from HCI, so it is the statewide data. And the numbers for these years, at least, is pretty much the same, but there is a little bit of a decrease. And that also kind of aligns with the Dental Transformation Initiative. So who knows? So there may already be some things in place that are trying to reduce this number, but not so significantly that these other recommendations offered may not be impactful. So, we still have room for change. And then just a caveat, and this isn't like the important takeaway, but just because it's a question we get is, well, why? What is the condition folks are presenting to the emergency department for? Can we just focus on preventing those specific conditions? And that's not what we really have good data on. While there are a lot of different dental codes that we can look for that are related to non-traumatic dental conditions, most of the time, really like almost 80% of the time, it's a code called Other Specified Disorders of Teeth and Supporting Structures. So we can't say it's abscess, even though if in our hearts we're like, but we know it is. Like we don't have the data to support that. So I just want to make that clear that that's also an opportunity with kind of like that medical dental integration. Is emergency department physicians are also frustrated with wanting to help their patients. The emergency department physicians I've had the honor to talk to, they want a better way to help their patients, but they don't have a mechanism for it. And they're looking for ways to also help their patients beyond just telling them to see a dentist. So I'll just finish with some other resources from the American Dental Association. It's a national campaign called Action for Dental Health. And these are their recommendations. So they want to connect patients to ongoing care. So that aligns with the state. a stakeholder-based program. So it's to emphasize the value of what dentists do, importance of having a dental home. So that is a place of care that is long-term. It's not a one-time pop-up of care. And then there's the American College of Emergency Physicians, which if you at the county level are looking to build some connections and don't know where to start, the American College of Emergency Physicians may be one place to reach out to start kind of building these connections. And thank you for listening, and